Hi everyone, I'm making this video to help you prepare for your hip replacement surgery. I've made these notes from my own experience with hip replacement surgery. I don't by any means intend for this to be exclusive. I want to help you think through the recovery process so you know how to plan, and you also have time to ask the questions that you need to your healthcare team. I've organized this by topics. Let's go through them one at a time, and I hope that you will help feel comfortable with your coming surgery. Prior to surgery, begin exercises to strengthen your muscles and ease your recovery. There are exercises that you can do that will make the recovery from the hip replacement surgery much easier for you. It's a bit of a double-edged sword. You're having the surgery because the hip joint's worn out. It's not going to be easy to do all the exercises. If you can persevere with them, the time and effort that it takes you to resume your mobility and get back on with your life will be lessened, and it'll be a much more enjoyable and easier process for you to go through. If applicable and time permits, reform your diet so you have a healthy body weight for your new prosthetic hip joint. There's nothing as good as your original muscles and the body that you were born with. The hip joints, unfortunately, are going to wear out. They aren't as good as your original bones, as I've said. It's very important that you maintain a healthy body weight, either losing weight before the surgery or changing your whole lifestyle as you recover from the surgery. It's very important you discuss with your doctor what a healthy body weight is for you and the diet changes that you'll need to undertake to lose the weight. I'm talking about this especially from someone my age, where the hip replacement surgery will need to be replaced again, and even possibly a third time during my life. It's really important that you do what you have control over so the hips don't wear out too soon. You don't want to put yourself in the situation where you don't have any more options for a hip replacement surgery. Replacing a hip is very similar to carpentry work. There's only so many times where a bolt can be put into wood and taken back out before it loses its strength and ability to grip the wood. The same thing is true for when you have a hip replacement surgery. The replacement can only be replaced so many times before your body isn't going to hold it tightly, and you're going to start needing bone cement to secure it into place. I'm not trying to deter you from having the surgery if that's what you and your doctors have talked about, but I want to help you make the best of the life that you are gaining back. Remove loose rugs and other tripping hazards from your living space. I've heard of a number of people tripping on floor runners, loose shoes, socks, and other things on the floor. I would suggest, if it's possible, to go around your space either with crutches or a walker and see what is going to be in the way so that the furniture and loose objects won't hinder you during the recovery. There's nothing more discouraging than getting the hip replaced and then taking a trip, causing a fracture, and needing the replacement replaced within a matter of weeks. So a little bit of prevention will go a long way to help you. Rearrange your furniture for use and ease of mobility with your crutches. So again, think through the space that you need to walk and then the additional width of your body once a pair of crutches have been added onto your width, and then ensure there's enough space for you to get around and without the crutches going to be catching on something that would potentially cause you to fall down. This is something that I'm sure a friend would help you do as you go through your house and you're working out the recovery. In fact, I've met a lot of people in my life that want to help but don't know how to help. Having a friend take up things off the floor that are tripping hazards and helping rearrange your furniture would help someone feel that they've made a difference in your life and have really contributed in a tangible way to the recovery that you're needing. I want to now talk about washing. You'll be able to wash from your knees up the same as before the surgery. So you may not be able to use the water pouring down on you, initially at least, but you could still perhaps use a face cloth as if you were sitting in the tub, washing your face and your chest and reaching around to your back. You will need someone to wash from your knees down, including your toes and feet. Now, this doesn't mean that someone needs to see you naked. You could consider washing with either boxer shorts or underwear or even shorts on so that you can maintain your dignity if this matters to you. But you will not be able to reach the lower part of your legs. And the reason for this is the risk of dislocating your hip joint, the new one that has been put into you. It's extremely important to follow the doctor's recommendations and restrictions that you're given following surgery. These aren't given to you for your doctor to be mean. It's so that you have the best chance at recovering as possible. If it's absolutely not going to happen that someone can help you wash from your knees down, there is the option of using a handle with a sponge on it, so you can use this to reach where you can't bend, and then use a hair dryer to blow dry your legs and feet. It's extremely important that you're dry between your toes when you redress. There's even sock horns that you can put socks on with and use a reacher grabber to help take them off once it's bedtime. It's going to take you more time than if you were to reach and do it yourself, but it can be done. And if you have the mind to do it and the will, it will still make your life as normal as possible. Entering and exiting a tub during the healing process may cause the hip prosthesis to dislocate. If you do not have a walk-in shower, obtain a shower chair for use during your recovery period. Also, use kitchen plastic wrap and skin tape to cover the incision while it heals while you are showering. So the idea with the plastic wrap and skin tape is almost like a big bandage. It's so water won't penetrate it. The catch is that you do not want to go take plastic wrap from your kitchen to the bathroom. You want to start with a roll that is fresh and has not been exposed to the germs that potentially could exist on what's already in your kitchen. You don't want to help give yourself an infection in your new joint. The person you ask to help with your knees down could also cut your toenails as needed. You know, there is a level of trust with this, and I understand that not everyone's going to be comfortable cutting your toenails. You do want to maintain them so they aren't catching on your bedding or your socks. It's also possible you've been prescribed to wear the tension stockings. You need to make sure that there's someone in place that will take care of your toenails. Dressing. If you will purchase a reacher grabber, you will be able to put on your underwear and loose fitting slacks, shorts, or jogging pants until you are into your post-surgery and the restrictions no longer apply to you. So a reacher grabber is like making your arm another 3 feet longer. It's a skill that needs practicing. So when I had my surgeries, I asked for the occupational therapist to go over this with me. I live by myself, and I actually have the strategies worked out to manage my day-to-day life. So it was just a matter of brushing up on how to change my clothes myself, and putting on my socks and a few things like this that I needed coaching on how to do. A reacher grabber is not expensive. It's well worth the money to have one. It also gives you the ability to pick stuff up off the floor if something drops by accident. A good reacher grabber will come with a magnet on the end of it, so if a coin or paper clip falls to the ground, you're also able to retrieve it without having to use the claw part. I've seen them for sale at the local dollar store. I've also seen them for sale at a hospital mobility type store. The hospital quality was better. It was made out of metal and aluminum, but the one at the dollar store also works perfectly fine. I'm trying to tell you that money should not hold you back from buying a reacher grabber. It would benefit you to have a long handle shoehorn. So I'm talking about a shoehorn that may be 16 inches or about 45 centimeters long, the kind that you can use while sitting in a chair and not having to bend. You want to be able to maintain the best independence that's practical I realize after having surgery you feel weak and you might not want to do a whole lot, but there are going to be times when you need to go out of your home, such as for pain medication with your doctor and the follow-up appointments that take place. I want to encourage you to do as much as possible. The people who drove me to my post-surgery appointments were very willing to put on my socks, shoes, and help me in any way that was practical to get me to the appointments before I left the house. Even the company that drives me in my electric wheelchair was willing to do this for me. It's an unusual request, but given the circumstances, it's perfectly reasonable, and again, it has that feeling of someone being able to help you but not exactly knowing how. I really believe that friends want to help and be involved, but you need to be able to direct them in what they can do. Given that a hip replacement surgery really needs specialist, an operation that's done by someone who's trained, the way to engage friends is either practical stuff with your body, preparing meals ahead of time, or sending someone out shopping. You could also consider having someone come over to your home to have a meal with you. Part of that would be the practical part of preparing the meal, but it's important that you have that company. It helps you heal better when your mind is at ease. It would benefit you to have also the sock horn. It's a different shape, more like a half moon, and then the sock slips on and you put your foot on as you pull your sock up. So it's a second tool that I want to encourage you to consider buying. You can go sockless, it's not unheard of, but if you're heading over the house, you need to think through what you need to be safe. If a sock is going to help keep you warm, certainly you want to make the effort to get it on you, whether it's you putting it on or taking it off. If you're putting on a sock and someone's helped you do it to go over the house, perhaps you could ask them to take it off of you before they leave for the night, so you're not stuck wearing a pair of socks in bed if this isn't something that you want to have happen or will interrupt your sleeping. It would help your recovery to practice dressing with a reacher grabber before your surgery. So I know I've already hinted about this. I just want to really emphasize it. When you're not feeling too good, it's easy to get frustrated and give up. If you already have the skill to dress yourself, it's going to make your recovery that much easier for you and will make your life a little bit more normal while you're going through the process. Meals. Cooking ahead and freezing will allow you to focus your energy on your physiotherapy. I have a number of glass containers that have a rubber seal and plastic lid. These are safe for the oven, and so I've even cooked meals in these and then put the lid on and put them in the freezer. It makes it a lot easier, and there isn't a big cleanup while you're preparing for surgery and not feeling that great from the hip pain that you're in. Think through what you can do for meal preparation in advance. Some ideas might be like meatloaf, potatoes, and vegetables. You could do soups, chili, you could do gumbo, whatever works for you. There is diet advice available that makes it easier for your body to heal. I can't emphasize enough how important it is for you to have a healthy diet during the recovery process. especially when your body is weak from having surgery. You don't want to end up with a flu that's going around town or a cold. Toilet. The angle between your chest and upper thighs can't be less than 90 degrees for typically 6 weeks post-surgery, although this does depend on your surgeon and the restrictions that you're given. You need the toilet seat to be high enough to accommodate this. You could use a raised toilet seat. That's about a 3.5-inch piece of plastic that will sit on the toilet, and then it comes off for cleaning. Another option is something called a toilevator. That is the same idea as an elevator. It's a platform for your toilet to sit on that raises it up. A toilevator is a long-term solution. It would be really good if you're a senior and having hip replacement surgery. Certainly adding the toilevator would make your life easier as you age. For someone young, there might not be the same urgency. The toilevators tend to be a few dollars more, but if you do have elderly parents, it might just be worth adding it in. Very simple to install. So I would suggest you look at both options. Me personally, I have both. I have the toilevator installed on my toilet. I own the raised toilet seat, and if I'm invited to friends, such as what happened following 3 of my adult surgeries, I was able to take the raised toilet seat with me, and their toilet accommodated me without undue risk to my hips and the operation that I underwent. Do your research. If money is tight, check out the secondhand stores. You can always come home and bleach a toilet seat so it's safe for you and gives you peace of mind to use. Okay, I want to move on now to medications. It would be very helpful for you to select a pharmacy which does home delivery service for your medications for the 6 to 8 weeks post-surgery, including medications for any other elements that you have. So what that entails perhaps would be having a friend drop off a prescription, or your family doctor faxing the prescription right to the pharmacy, and then calling them up on the phone and saying, "Will you deliver this to me?" Where I live, prescription delivery service is available free of charge. You have to choose the morning, afternoon, or evening time slot. I've been using the prescription delivery service for several years because of my long-term physical disability. I know the driver and trust him. When I was having my surgery and just the days following it, I stuck up a note on the door saying, "Jerry, the door's unlocked. Will you knock a few times and let yourself in?" And there is that trust between Jerry and myself that he was willing to do this. This may not be for everyone. I get it. I just want you to think through what time you would be awake for your prescription delivery. I was so weak from the broken sleep leading up to my surgery that I wasn't going to be awake at any of the times, and it's just easiest to stick a note on the door to let himself in when he arrived. I taped the note to the inside so it wouldn't draw attention for someone walking down the street. You'll have a sense if this is practical and safe for you to do where you live. There's also the option of having friends go pick up your medication. You do need to make sure you have time to answer questions to the pharmacist if you have any, and understand how to use the medications that you're prescribed. So from time to time, the pharmacist checks up with me by phone just to make sure I don't have any new questions. There would be nothing wrong with you receiving your prescription and then calling and asking to speak with the pharmacist. They've always been friendly with me. I can't say enough about using the pharmacist as a resource and a sounding board. They know what their skill level is and will refer you on to your doctor if what you're asking can't be answered by them. But a lot of the times for me, a simple question can be answered by talking to them instead of a trip to the ER or to my family doctor. I now want to talk about the topic of sitting. This is really, really important. You could do a lot of damage to your new hip if you don't get it right. The angle between your chest and upper thigh can't be less than 90 degrees for typically 6 weeks post-surgery. Again, this is where you need to take part in your health care and find out what your restrictions are. Make sure you live within those restrictions. What it means is having a few extra cushions to prop yourself up, or buying a chair that maybe would be used at a bar where you're sitting up and an extra 3-4 inches. Work out what's going to be comfortable for you. It may mean that you need a break from the sofa because it risks dislocating your hip. Think through before you sit and do irreparable damage to your hip. I can't overemphasize this enough. I don't want to see you go through what some of my peers have with their hip replacement surgeries failing because of violating the restrictions, although accidentally, but nonetheless violating them and having the hip dislocate. At your request, the physiotherapist can measure you to find out the optimum height for anything you sit on. The toilet, the chair, side of your bed. They can also mark this with a bit of tape around your crutches, and it would be a simple way of leaning your crutches beside what you're about to sit on and seeing if the tape is at least the same height as the seat, or do you need to add a cushion to this. This will allow you to adjust the chair height you sit on during the recovery period, both at home and at social engagements. You might wake up, feel like you're wanting to go out for coffee with a friend. If you have the strength, I encourage you to do it. Maybe you want to attend church but need to bring a cushion with you just to sit high enough up. Nothing wrong with it. Even sitting in the aisle on a chair wouldn't be the worst thing in the world. If you're having surgery, it's understandable. When your mind's at ease and your life is normal, it puts your body under less stress and you do a lot better during the recovery. The physiotherapy is a crucial commitment for anyone having hip replacement surgery, even if you unfortunately had a fall and weren't planning on an operation. An exercise bike would be very helpful in re-establishing the motion in the hip being replaced. The reason I bring this up is not everyone's going to have the money to go to a physiotherapist a few times a week. However, you could invest a little bit of money in exercise equipment for your home that would let you do more for yourself at home, or even get a membership perhaps at a YMCA where you could use their equipment when you don't need as much oversight. So there are ways of working around a very tight budget. I've had to address this following several of my surgeries. I sincerely understand the stress that money can bring to a surgery and the recovery. Talking things out and being honest when you don't have the money with a physiotherapist may bring out creative solutions, such as asking for a home exercise program. Ankle weights would be another helpful tool to build strength, starting at approximately the 8-week following your surgery. Now, you can't automatically go use ankle weights. You need to make sure that you've been cleared for this. There's going to be a period where this is too much stress for your body and would do more harm than good. Once you've crossed that point and a physiotherapist or your doctor says it's safe, buying a set of ankle weights that have multiple pouches means that one weight will let you do between 1 and 5 pounds instead of buying 5 separate weights. This was one of the pieces of equipment that a physiotherapist asked me to purchase in 2006, and it's been very much worth its money. Pre-surgery, using weights on some type to build muscles in your arms will help your ability following the hip replacement. There's a lot of upper body stress required when you're first getting over your hip replacement surgery. You want to do what's possible to tone up your arms and increase the strength. Now, building up strength takes time. If you overdo it, you're going to end up very sore, stiff, and even possibly hurting yourself. So if there's a plan in place that you're having surgery in a few months, this is something that you can work up to, and your doctor could help you plan for how much to do, how often, and then if you want to progress, what more weight you could add. It's just another thing to think through if it's practical for your situation. Follow-up appointments. It is typical to have a weekly blood test while taking a blood thinner post-surgery. Typically, the blood thinner is administered for 4 weeks, starting the day following the hip replacement. You will need reliable transportation in order to attend your first follow-up appointment post-surgery, approximately 6 to 9 weeks after being released from hospital. So I want to first talk a little bit more about the blood tests. There is the option to have it done at home. There's usually a nominal fee associated with this. Talk about this with the nursing staff at the hospital. They seem to be the ones that are in touch with what community services are available. Certainly if it's snowing outside, it would be easier to have someone come to you to take your blood instead of going to a clinic. I've done both routes, having blood drawn at home and going to the clinic. The reason I did the blood draw at home was because of a winter surgery and living in Canada. Now, the transportation to your follow-up appointment. It's easiest if the seat is all the way back. There's a whole technique to sitting in a car and getting your operative leg into it following the surgery. Each time I've had a hip surgery, the hospital has given me a kit including diagrams of how to walk up and down stairs, as well as entering and exiting a car. It's also included diagrams for resuming sexual activity. So you need to look at the advice that you're given. The written documents will help you remember what is the right way of doing this. Again, you want to do what is within your ability to control so that the healing process goes right. It's only for a short period of time where you're being inconvenienced, but in the scheme of things, a hip replacement surgery has such an ability to improve your quality of life, increasing your mobility, reducing pain, and gaining new independence, even having a fresh start at life so you can travel. So it's worth the 6 weeks or 8 weeks that you're feeling blah just to get through it, and then plan on making some changes with your life so you can start living again, whereas your hip could have held you back during the previous year or two. I finally want to talk about your mental health. Plan ahead so you are taking care of your mental health during the recovery from surgery. What this means for me and what this means for you could be different. Think through how you respond best when you are feeling vulnerable from either broken sleep or pain, and the types of support that you need. Maybe it's that you have friends scheduled to have a meal with you twice a week. Maybe it's that listening to your music will help you feel whole and not put stress on your body. There are benefits to keeping your mind healthy and active during the recovery. It could mean taking time to writing some thank you cards, or even cards to encourage people in your community. Just finding some small tasks to do each day goes a long way. And I might include, I believe in God in this area, and praying to God for comfort is perfectly reasonable. It's a different relationship when you're feeling weak, but the Lord is still there even when there's challenges and you're not at your best. I want to wish you all the best with your hip replacement surgery procedure, and here's looking to the new life that you're going to have. Thank you very much for this time that you spent with me today. Bye for now.